Today we are covering one of the most important and heavily tested management of care concepts on the NCLEX, delegation and supervision. The exam expects you to know what a registered nurse can safely delegate to a licensed practical nurse or an unlicensed assistive personnel, and under what circumstances. Making the wrong choice on the exam can lead to a critical error, so let's master this. The foundation of safe delegation is the 5 rights of delegation. These are the right task, the right circumstance, the right person, the right direction, and the right supervision. The NCLEX will test your application of these rights, not just your ability to list them. For instance, an exam question might give you a list of tasks and ask which one is appropriate to delegate to a UAP. You might see options like administering a PRN medication, performing a sterile dressing change, ambulating a stable post-operative patient, and developing a plan of care. The only correct answer is ambulating the stable patient. This falls under the right task, as it's a standard, routine procedure, and the right circumstance because the patient is stable. A major trap for test takers is failing to differentiate between the roles. Remember that UAPs are primarily for tasks of daily living on stable patients. Think about activities like bathing, dressing, feeding, ambulating, and collecting vital signs. However, the NCLEX loves to add a complication. If that same stable patient suddenly becomes dizzy or short of breath, taking their vital signs is no longer a routine task. The circumstance has changed, and it now requires the assessment skills of the RN. The LPN has a broader scope than the UAP, but it is still limited. LPNs can perform many tasks, such as monitoring ongoing findings, reinforcing patient teaching that was initially done by the RN, performing tracheostomy care on a stable patient, checking NG tube patency, and administering certain medications. They operate with stable patients who have predictable outcomes. An exam question might ask who should care for a patient with a chronic but stable condition like COPD. The LPN is a great choice, but if that same patient has a sudden acute exacerbation, their condition is now unstable and unpredictable, meaning the RN must provide the care. This brings us to the most critical point and a great mnemonic to remember what an RN can never delegate. Remember the phrase, "You cannot eat your young." EAT stands for evaluation, assessment, and teaching. These 3 tasks require the specialized clinical judgment of the registered nurse and can never be delegated. The initial assessment of a new patient, the evaluation of how a medication is working, and the primary teaching session for a newly diagnosed diabetic must be done by the RN. The exam will try to trick you with subtle wording. It might say an LPN can reinforce teaching, which is true, but they cannot do the initial teaching. It might say a UAP can report on a patient's pain, but they cannot assess the pain. Pay close attention to these action verbs as they are clues to the correct answer. The final right is right supervision. As the RN, you retain ultimate accountability for the patient's outcome. Even when you delegate a task, you are responsible for supervising, guiding, and evaluating the outcome. A question might involve a UAP reporting a very high blood pressure reading. The correct nursing action is not just to document it, but for the RN to immediately go and assess the patient. This demonstrates proper supervision and fulfills your duty as the RN.